Just
Just checking I'm still audible.
yeah,
Great.
we can hear you.
Cool. There are 5 teams in this house, so apologies if there's some background noise. Also, just a warning: the speech will, as per the realm of the topic, have some mentions of domestic violence, eating disorders, etc., etc. Cool. Starting in 5. Popularization of therapy speak is the popularization of the most harmful form of mental health discourse. It is not accurate, it is harmful to those who are the most vulnerable, and it encourages people to misdiagnose themselves and others in ways that don't lead to resolutions for those who need it, and in ways that continue the abuse of people who need to seek help. On our side of the house, we're going to prove that that norm is a harmful norm, and we're going to give the most important reasons why that is true. Quickly, some setup, then 3 points. Firstly, why it undermines the importance and the ability to seek help from those with experience with these issues. Secondly, how it leads to misdiagnosis and a number of harms from that. And finally, how it's used by abusers and relationships to get a whole bunch of harms. Quickly on setup, what is popularization? It's what's discussed in the info slide. I know there's a wide range of things that can be covered, but the key thing is that these are never accurate medical definitions, and they're used widespread in society by people with little to no knowledge about what these things are. They do it because they think it's the norm of what they should say, what they see on TikTok, what they see their friends doing. It's not great. But secondly, what is the counterfactual? Obviously, these terms are still used in their medical use by medical people. We think people are still aware of these issues. They're taught about them in schools. They're taught about them by their family, by their doctors, if they have any relationship with them, or even if they don't. But also, it's just like there's probably in the absence of this norm, there's still an impetus to discuss issues like mental health, and it's probably likely that they will be discussed in a more accurate way. So firstly, how it undermines the importance from those with experience. For example, let's just look at the instances that are given in the info slide. If you're using like the casual use of the term OCD, it is not usually used by those who actually have OCD, right? Because those who have that issue, that illness, are probably unlikely to be using it in the most callous way. And similarly, if you're using gaslighting as a term, that's used by literally everyone in society at the moment in youth culture in all sorts of situations, very few of which have any relation to actual gaslighting as it occurs in its most harmful form. What are the harms of this? The first is a principled harm of the norm itself. That is, even if you can't, don't accept any other harms in terms of people's ability to rectify themselves, I will prove here that it just makes people feel bad, and that is something that we should oppose. So the first thing to note is that people who say these things don't know whether the people that are hearing them have these illnesses or not, or they, are associated with these issues. And if, insofar as you don't know people's experience, you don't have an ability to self-censor themselves. Even when they do, they often don't care. But secondly, it just makes them feel awful because they know that others are viewing their serious issue that has plagued them for their whole life as a joke and something that should be laughed about. But secondly, it's particularly harmful because you lose your ownership over your own narrative. That's particularly important for mental illness. It's particularly important for domestic abuse because often the people you come to for support are your only way to actually claim some sort of control in that narrative, and they're directly undermining your control through use of this norm. Secondly, you're much less likely to speak up. That is because you think people won't consider it as serious. It's secondly because you won't consider it as serious because you believe that because this norm is widespread, maybe my issue that I have isn't actually that important. It's something that, everyone has and I shouldn't actually care about it that much. But thirdly, even if that's not true, it's much scarier to reveal specific symptoms of that issue that you have, right? So even if you're willing to say, oh, I have OCD, you're not going to say what symptoms you have because they're incongruent with what you think the wider norm suggests. The third thing to note under this point, though, is it is less likely if you do speak up to be taken seriously. That is because most people don't have a vested interest in caring a lot about these issues to a particularly nuanced extent, which means they're unlikely to decouple this norm from its medical usage. And so when you say, you have OCD, they're not going to go and read a medical textbook and explain what that OCD is and how best to help it. They're just going to base their help for you based on their knowledge from this norm. That is bad for a number of reasons, but particularly because it means that you associate and they associate you with the incorrect symptoms. That is particularly important because many people can't afford proper therapy. Their friends are the best way that they can therapize each other. And when you take away the ability for that to be accurate, or to be taken seriously, they're less likely to seek help. When they do seek help, it doesn't happen. But finally, under this point, if you do go to therapy, you go in with preconcerned notions of what your issue is likely to be. Those notions are obviously incorrect. That means there's much more work for therapists to actually convince you these are the actual symptoms that you should care about. Particularly in instances like domestic violence, it's much harder for therapists to convince you that you have to leave that relationship. That puts people in a whole bunch of danger. I'll take CO.
In terms of its usage as a joke or whatever, do you not think without therapy speak that comparative would be something like more hateful terms like slurs?
So we don't think most people are likely to use slurs against people in casual situations. There's a high barrier to entry to, being able to say something you'll get discredited against, particularly to those who you're close with. Maybe there'll be some tiny marginal increase on slurs on the street to random people, but we don't think that has as much of an impact as what you do with the use of therapy speak. People use therapy they speak because they think it's normal, they think it's not offensive, but of course it is. So let's talk about misdiagnosis, because this norm includes diagnosis, obviously, but that diagnosis is likely to be wrong for 3 reasons. Firstly, you have no medical skill. Secondly, you have your own personal biases and experience. But thirdly, you just don't know what the actual symptoms look like. It's very different in pop culture to what it actually is. The harms of this accrue to a number of stakeholders, to your friends, to your partners, but also to public figures. Like when people label Joe Biden as someone with dementia, and in the media, that's often used in an insulting way by people on the right wing on Twitter. And it hurts, it deeply hurts those with similar issues who feel like their mental illness is something that is embarrassing, that public figures should be embarrassed for. Harms of this, 6-fold. Firstly, you might self-medicate, and I think a lot of people are likely to self-medicate for illnesses that they don't have because they're misdiagnosed. Big harms, overuse of opioids and stuff if they go that far. Secondly, because there is now stigma on you because you are now diagnosed, but importantly, you're diagnosed behind your back. People stigmatize you without you even knowing. Thirdly, there's often a placebo effect for things like anorexia. If you get told you're anorexic, you might actually be more likely to become anorexic as a result. Fourthly, when diagnosis happens, it happens in sexist ways because people are less likely to listen to the concerns of women. And fifthly, it's harder to resolve issues when they happen. Firstly, because small issues now seem bigger than they are, but it also means you don't analyze the actual causes. Final thing to note is because of all the harms of wider discourse, these norms become cemented in society. It's controlled by the media in a way that is harmful to those who are the most vulnerable. Finally, it is used by abusers because those who have power in relationships are able to use this easy language to weaponize as rebuttal against their victims. Because it is so mainstream, they don't need alternative justifications for their behavior. That makes it much harder for people to leave relationships when they need to. It makes it much more likely that they stay victims of violence. For all of those reasons, therapy speak is inaccurate, it's harmful, and we should oppose it.
Thank you very much for that speech. I'd like to call upon the first speaker for the opposition.
Am I audible?
Yes.
Okay, I just need to get my timer. Be right back. I should unmute myself. Okay, starting in 3, 2, 1. Panel, and there are places where there's a lot of stigma on mental health issues, and at the moment there's a lot of underdiagnosis of these issues. We say that this is a kind of narrative, and the use of this language is going to be good. So let me actually give you some more framing that opening government fails to do. Firstly, on the speculative diagnosis, I want to know that oftentimes these are people that you often know and work with a lot, because it oftentimes makes you feel comfortable to even do this in the first place, because it's very weird to tell a stranger like, oh wow, you have so ADHD, wow, the mao, because it might like turn them off or be angry at you, but also you actually feel more confident kind of like doing this because you see more sides of them, you see like more likely to see patterns and all those kinds of things. But secondly, at the moment we're going to say the terms, we're going to clash with opening government, and we say actually oftentimes people do know what they are. Firstly, know that oftentimes they're used by people who have been in therapy themselves, right? That often people go go and use it and feel like want to normalize the usage of it themselves. But secondly, also oftentimes say that at the moment that you don't understand actually what schizophrenia is, at the moment you're going to hear it more used, you're much more likely to also look it up. Then you're going to actually look this on the internet, find a definition and just an explanation of this, and you're much more likely to become on mental health awareness issues, awareness YouTubers or whatever, or like experts who are going to explain it to you. But thirdly, what you say is oftentimes we see a trend with TV shows at the moment that they're going to show this because they, you know, it's like the new spicy thing. They're often doing it well because they often have specific teams who are going to test if it's going to be like a good representation of it with experts, but also with the increase of intersectionality and big part of it also being mental health issues being more important in social movements, you're much more likely to get more backlash at the moment you're going to have this bad representations of TV shows. Therefore, we say actually the media representations of, for example, autism has gone up way better, right? We see, for example, The Good Doctor has a way better representation of, for example, Sheldon over the years, and therefore say actually there's an increase in better trend, and therefore you create more awareness. We say at the moment, they say, the alternative is like schools. Oftentimes they do it in a dry way if they do it in any way, but also parents oftentimes don't know the terms themselves or aren't aware of them. Therefore, you need this narrative to actually make people aware of this. So then why is it actually important? Because it's, why is this important? Because we say it creates more awareness of the patterns that people have, right? Because firstly, note that oftentimes patterns are internalized the moment you have a mental illness, for example, a development disorder such as autism, that you see an extension of yourself, but oftentimes people see as a psychological problem as outside of them, something that happens to them. There often therefore is a disconnect at the moment you see the pattern. But also secondly, they often don't want to be different from the rest. And therefore, at the moment they're going to find something, they're going to internalize and say, no, that's just what I am. But secondly, they say that oftentimes people don't always know other people's norms. That's to say, you don't always know how a normal person behaves specifically. So the moment that you are, for example, neurodivergent, you're much more likely to see like that as the norm in the first place. For example, being very clean in the first place, or being very sensitive to force sounds. Towards sounds. But thirdly, we say oftentimes people also mislabel it, right? At the moment you don't have this narrative, you're oftentimes going to label it differently. For example, you're going to say, instead of having, for example, seeing yourself as introverted, you're actually much more likely, that's more likely as to see yourself as introverted, rather as you're most likely going to be, for example, actual autistic, because you feel like, you know, you're overwhelmed by stimulation, so you have like sensitive to specific senses, you're much more likely to see that, oh, I don't want to be in like big social situations, parties, because they kind of like freak me out. You're much more likely to then mislabel to introvertedness, right? Because we therefore say that most likely you're already going to have an underdiagnosis of people who actually have mental health issues. Therefore, you create now a delta in two ways. Firstly, note, you're much more likely to actually be aware of the terms I just explained, because they're much more likely to be common within usage. But also, secondly, you're much more likely to going to have now more introspection. That's to say, at the moment you're going to be diagnosed by, for example, your friends with ADHD, right? So some of the friends do this with me, and I just look it up on the internet and be like, well, ADHD is these terms. I do check myself up and be like, oh no, I don't have these terms. It makes me like maybe more aware of the different patterns that I do have that agree with it. Therefore, you create more awareness of yourself. We say that this is important because all my analysis where people are unlikely to see the patterns which might be make them different and much more difficult for them to actually get help with, because they see it as a normal part of them. But secondly, we also say and oftentimes at the moment that you do believe that you're going to have them, then if you don't going to have at least these checks, you have like some form of a structure to base it on, compared to having no structure to base it on. But we also say that oftentimes there's a lot of like underdiagnosis. For example, the fact that there are a lot of like women with ADHD and autism who are underdiagnosed, but because you now have more awareness and more people actually looking these things up, you're also much more likely to create awareness for example, how women have ADHD and autism differently than other ones. But also we just know there's often a skill, right? That oftentimes at the moment you don't have this usage, then most likely the things you're going to associate with autism are going to be like the very extreme, such as Sheldon, compared to what oftentimes is more normal if you have, for example, high functioning Asperger or other kinds of things. You're much more likely to now acknowledge the skills, but you also create more like, because so that means overall you get more diagnosis of individuals who actually have these diseases. If there's a PY from CO, CG, I'll take it.
No POI.
OG?
No POI.
Okay, I would answer it very smartly. Note that, panel. Okay, so why do you now get more awareness? Like I already explained about these checks, but also more likely at the moment you're going to have these patterns, right? So let's take the best case scenario for their stuff. Let's say you don't have, for example, ADHD, but people tell you you have ADHD anyway, right? Know that you're still much more likely to actually acknowledge, right? Because this happens for a reason. It is, for example, that you're not as attentive when you look at other people, when other people are talking, you're very fidgety. You're much more likely to then actually try to help yourself. We don't think this is going to be like, as OG says, you're going to do opioids. We think that's a very extreme thing to do. We think you're much more likely to actually look up things that might help you. E.g., at the moment, you just have an uneasy mind or get overstimulated quite quickly. You're much more likely to, for example, look up things as meditation or just exercise at the moment you're overstimulated to calm yourself down. We therefore say that even if you don't have those specific diseases or mental health issues, that you at least have like other coping mechanisms that you can create at the moment that you actually have this happen. But we say, secondly, you also actually create a possibility for individuals to go to therapy, right? Because it becomes more normalized now. You get more information about your disease. You feel like you're much more likely to be able to see yourself as an individual who needs therapy. But because also this fact, this is used by people who oftentimes go to therapy themselves, you also create a dialogue right now, right? Because oftentimes it is used for people who have had therapy, and then it's kind of like the same way they use dark humor, right? This is a way for them to cope with their issues, but also actually open the window for them to talk to other individuals about the therapy, meaning you're much more likely to be able to convince other people to go to therapy in the first place. And therefore also much more likely you're going to actually go get help. We think this is important because oftentimes this just means that at the moment you do need medications, you are going to get that. At the moment that you do need more explanations on how to cope with these issues, you are more likely to get this. We think therefore on the other side of the house, we're much more likely just to simply save more life. We therefore say, because of all the framing, why you're actually most likely to know these terms, and if you don't know the terms, you're going to have like a good way to explain this. We basically deal with the whole point of misdiagnosis that we get from OG, and therefore much more likely to save people's lives who have this mental disease, mental health issues, or going to actually also have better people who don't. We therefore say more self-awareness, therefore you get better issues, better to deal with your issues, therefore you should vote OO.
Thank you very much for that speech. I'd like to call upon the second speaker for the government.
I'll take my POIs in the chat, please. Let's be very clear. At this point in the debate, all of OO's benefits revolve around the concept of awareness. I understand why awareness might come from more discussions of mental health or better discussions of mental health, as they are happening more and more at this moment. But it's unclear why they come from the societal change in the definitions of terms related to mental health, or in the way in which they become social media trends that totally ignore and take them away from an original meaning, often grounded in complex understandings of trauma. I'm going to ask two questions in this speech. Firstly, how and when is therapy speak actually used, which I don't think has been discussed enough up until now? And secondly, why does it make mental health discourse more harmful? Firstly, when and how is this used? This is incredibly important because a lot of OO's benefits regarding awareness rely on it being used in the best or in the most educational ways. And in dealing with each of the examples in the info slide, I'm going to prove to you why that's not the case. Let's start with the popularization of terms like toxic and gaslighting. The way popularization has expanded the use of these terms is most often not in a way even close to its correct definition. Important context for this is that the popularization of terms like toxic and gaslighting have come largely from social media platforms like TikTok. And there are two problems with this, the way in which the popularization has occurred. The first is that it's often satire. It's girls posting TikToks being like, haha, I'm toxic because, my boyfriend's toxic because he didn't get me an iced coffee, or, he's a Gemini or whatever. It's very, very rarely in relation to actual acts of toxicity. But secondly, even worse, not only is the way it used incorrect, it's often opposite. So things like being toxic or gaslighting someone has been flipped into some sort of empowering trait, often with regards to women, like, the idea of like gatekeeping, girl boss, gaslighting, or like, the idea that like, I'm going to be the most toxic girlfriend ever, he doesn't know what's coming for him. Not only do we diminish the extent to which things are toxic, we flip them around so that the connotation totally changes. And the way that perpetuates without any thought is these become little trends where people post their own videos and they don't give any thought to what the definition of these words mean. Secondly, things like OCD and ADHD and diminishing the symptoms of very serious illnesses often starts like in the classroom or with children, people who are unlikely to look up the term because they're very young and more likely from a young age to understand the mental illness in an incorrect and often an ableist way. But lastly, let's look at the diagnosis of people like celebrities. They are often women, they are often women going through difficult times, and they are often based on things like appearance and fat shaming, particularly perpetuated again through social media and through gossip magazines. What does this very important recharacterization of these terms mean? Firstly, it means we have little control over how they are perpetuated and their understanding because of very quick social media trends. And secondly, because they're often used as a vehicle for discrimination. So even if they're not bad in and of themselves, the fact that they advance things like sexism and ableism and even ageism, if we're talking about things like Joe Biden, is bad in and of itself. The second question I'm going to ask here is, what does this popularization replace or take the place of? Because in a POI from someone, they suggest it takes the place of like slurs and things like that. But that is incorrect because in a lot of cases, they're not being used in a negative way that, you know, and I think realistically, it takes the place of just talking about behavior as annoying or negative or funny or dumb. And that's very different to pathologizing behavior in a way that comes at the expense of many people that experience it in a debilitating way. So now we've cleared up where this is used, where the popularization has come from and where it is going. Let's talk about the harms to mental health discourse. Note here that when people use these terms incorrectly, they've likely never been exposed to or experienced this type of mental illness because otherwise they wouldn't use it wrong. So we're dealing with people with absolutely no education or experience here. That's important context to literally the only material we hear from OO, which is awareness. What do they say? They say that this means people who don't experience the illness are more likely to look it up. But why? They literally never explained why that is the case. And especially if the societal definition has changed what toxic or gaslighting means so much so that not only is it not that bad, but it is attached to positive connotations, why would you look it up? What would make you look it up in relation to trauma or abuse if you literally have no idea what the original meaning comes from? But even if more people know the word gaslight or toxic, if they know it badly and if they're unable to apply it to situations correctly in a way that could help someone or in a way that could clarify, no thank you, their own relational experiences, there's no benefit that the opposition gets. But secondly, what about awareness when it comes to people who actually have things like ADHD or OCD? A couple of responses to this. Firstly, the idea that this would give them awareness relies on the term or the diagnosis from someone else being even vaguely correct or applied correctly. And I think the context I provided to you in my previous point tells you why that is not the case. They are often totally strayed from the original definition. Secondly, when they are used, they are often used in an ableist way. So even if someone can identify with the symptoms correctly, they're not going to talk about it or seek help because there is a stigma associated with it. Before I move on, I'm going to take a POI from closing.
Yeah, so how does a bunch of your analysis about the way that people misuse this, all these kinds of things, work within your own setup at the top of the debate about the impetus to discuss mental health and have accurate mental health discussion within society? Your own framing kills a lot of your points.
Our framing is this comes at the expense of that discussion, and the analysis I give you is the reason why it does, because these definitions totally stray from anything that vaguely resembles an important discussion of mental health and takes us further and further from where society did have an increased awareness of mental health, and that was good, and we've lost a lot of the benefits that come from it. Why can we get the awareness opening opposition wants elsewhere? We can get it from just greater discussions of mental illness, not ones that diagnose people randomly for joke or satirical reasons on TikTok. But we bring you so many other harms. Firstly, this is often ableist in a way that means people are less likely to spread awareness themselves who have these illnesses or tell people that could help them. Secondly, it leads to stigma. Thirdly, it's often a vehicle for discrimination. And lastly, it can be co-opted by abusers to validate and legitimize their excuses for negative behavior. Because this popularization takes place on a platform and in a world that will never be able to truly understand it and will always lead to harmful side effects. Even if it's used in the best way possible, we win this debate.
Thank you very much for that speech. I'd like to call upon the second speaker for the opposition.
Am I audible?
Yes.
When my friend jokingly tells me I'm schizo posting on Twitter, I don't think I actually have schizophrenia. OG is really uncharitable to the framing in this debate. I will do three things in my speech. First, responding to the OG pushes. Secondly, explain why even misdiagnosis is better than the counterfactual. And thirdly, where we get more accurate diagnosis inside OO. OG is correct to pinpoint that sometimes these terms are used satirically to just have fun on the social media or to make or to just satirize someone. Note that people can distinguish between frivolous and non-frivolous usages of these terms for four reasons. First of all, the context. If you tell your female friend that she is girl boss gatekeeping gaslighting you know that this is a joke that you're talking about. However, if you see someone who actually might be schizophrenic, they're getting lost in their thoughts, they're repeating the same thing over and over again, you're unlikely to misuse these terms because you identify that they might actually need help, and most people have a baseline level of empathy or at least concern not to use this when people are A, not close to them, but B, seem to actually be ill and in need of help. Secondly, as OG identifies, there is growing mental health awareness. Note through media, it becomes popularized because people want to see these unique stories in shows such as Euphoria. And usually big media companies have like target groups there where they test if the terms are actually used correctly. So people who consume media now, especially young people, know that there actually is an actual phenomenon called gaslighting that is different when I say gaslighting to my friend. Thirdly, just mental health advocacy due to the fact that most social justice movements now are intersectional, e.g. they recognize that oppression intersects with other oppressions. So even socialist and feminist movements talk about the way abusers, for instance, use gaslighting on women often, so people know the different ways in which the term such as gaslighting is used. And secondly, I think people know now are informatically literate, so they know when they Google the difference between some random pop article from Vanity Fair explaining what gaslighting is when Jennifer Lopez does it to other celebrities, and when WebMD or Wikipedia gives you a list of criteria. When people look this up, they're more likely to go to these credible sources because they can know the distinction. This means that most of OG's case is marginal because most people are culturally, socially, and technologically literate enough to know the difference. I would also like to talk about the three specific examples OG talks about: politicians, women, and abusers. First, on politicians, know that politics is an arena where candidates smear each other all the time to ruin their reputation. So instead of dementia, Obama was called a terrorist Muslim, so I don't think the harm to the politicians themselves or to the people who identify with niche identities that are slandered is that comparative. But I think it's better for people to call Joe Biden demented, because then you have mental health experts on the other side of the aisle go on left-leaning and centrist media outlets and explain, no, Joe Biden actually does not have dementia, and these are the real signs of the dementia, triggering this discourse happening. But even people who falsely believe that Biden has dementia don't believe it genuinely, right? They don't actually believe he has dementia. They're just using it to get political points. At least they're more likely to look it up on the internet and see on the credible sources that they are wrong. Secondly, on women, I think this is entirely uncomparative, because yes, you might call your female boss bitchy, you might call her like OCD, or might call her, that she has ADHD because she overmanages you, but the counterfactual is that if you have misogynist tendencies, you would use misogynistic language anyway, such as calling her a bitch, such as calling her with whichever other demeaning tool you have in your arsenal. The difference here is that now you can be called out more efficiently, that you're actually using a term that is scientifically inaccurate as opposed to slurs that have no similar mechanism of call out. But thirdly, on abusers. First of all, abusers have ways to isolate you and emotionally manipulate you anyway, because they don't want you to talk to your friends. They demean your self-esteem all the time. So I'm not sure how them using psychoterm is going to have any of a difference, but at least now there is more awareness that gaslighting in particular is a strategy used by abusers to tell you that something that happened to you actually did not happen. So you have more of an ability to identify when abusive behavior does happen. Secondly, on misdiagnosis, right? Even if misdiagnosis happens, it's not that big of a deal. Note that all mental health diagnoses are arbitrary because they are based on quite vague definitions, such as this might cause harm to your personal life. Note that homosexuality was a diagnosis 50 years ago, and it was semi-accurate according to the definition, because it can cause harms to your personal life. You might be ostracized by your community, your marriage might be ruined if you're in a heterosexual marriage, etc., etc. But now things have changed. So even if you have a definition of mental health that might not be completely accurate, it can still help you. Why? Because I think it allows you to have a philosophical framework by which you understand your own experiences. So even though I was never diagnosed with ADHD, it helps me to think that I might have ADHD because sometimes I completely forget to do things. And otherwise I would just feel guilty. Why am I this different? Why do I forget to submit this paper? But if I misdiagnosed with ADHD, at least I know, it might not necessarily be because I'm inherently a bad person. At least this objective thing can explain it. But secondly, it gives you a language to talk about it to other people. I can now relay my unique experience to others and they can understand it. But why do we actually get accurate diagnosis? Piotr identified multiple issues in the status quo as to why there isn't enough discourse about mental health. It is stigmatized in many places. There is a lack of an awareness. You have a selling of internal guilt. OG just vaguely says there are other ways we can discuss mental health. We agree, but this motion is uniquely good because it popularizes talk about mental health. And it's not just satirical talk between different people. Piotr it's also talk between your friends. You talk about each other, oh, I might have ADHD, I might be too OCD. In many cases, this isn't true, but at least it gives you the ability to open up if you think that you might have something. I'll take a PA from closing, quickly.
Do you think the stigma associated with all kinds of mental health are the same? So for example, comparing OCD to toxicity, for example.
So when it's more serious, you're likely to go to a therapist. Why? 3 reasons. First of all, you want drugs, and access to drugs on the internet is inconsistent because the sites are shady and most people don't want to do illegal shit. So they're likely to go to a therapist anyway. Secondly, they want legitimacy. So if I think I might have OCD or ADHD, this might encourage me to get a stamp of approval from someone who is an expert so I can brag to all my friends and get like virtue signaling points or whatever. Thirdly, part of this popularization is like, go get therapy and stuff like that on social media, valorizing therapy. So really more likely to go there. Why is this good? Because if your self-diagnosis is wrong, the therapist will correct you, and then you will see them as a figure of authority. So you will discard your identity that might not be actually conducive in the long term. But if the therapist helps you find the right diagnosis, this can be life-changing because now you can be put on antidepressants and might not self-harm or try to commit suicide. If you have autism, you will develop ways to cope it. So even if you buy nothing else on the top half class, at least comparatively more people will be compelled to go to therapists who they see as figures of authority, who will give them an accurate diagnosis along with drugs and methods they can use to cope with their mental health conditions that otherwise could be debilitating. I am so proud to win this top half.
Thank you very much for that speech. I'd like to call upon the 3rd speaker for the government.
Can you hear me clearly?
Yep.
Just clarifying the alternative to start off with. What we don't want is a series of public discussions that diagnose real people. We are completely okay with hypothetical discussions on mental health to happen through mainstream TV shows, and also for published articles by professionals to be proliferated amongst people as much as possible. We think there was an increasing trend of doing so as society liberalizes, as society starts accepting these ideals more, maybe at a slightly slower pace than opposition, but it would happen regardless. Secondly, we prefer individuals seeking out and choosing help when they're ready. We do not want society to diagnose individuals on their behalf and forcing them to believe they have a disease before going forward. First piece of extension, what kind of diseases are likely to be diagnosed in such a context? The first thing I'd like to say is that not all mental health, when normalized and when made aware of, necessarily has positive associations with it. So for example, things like PTSD and OCD are naturally associated with something that's very neutral, right? You tidy up something a lot, or you have trauma of the past. But certain kinds of mental health language directly associate negative connotations with them. Things like you are toxic, you are a gaslighter, these kinds of things, regardless of how much the awareness is, the stigmatization only increases at a point in time where you're made aware of such diseases. First point of framing. Second point of framing, what kind of diseases are you more likely to diagnose from the perspective of society. You are more likely to diagnose the diseases or mental health issues that have negative connotations associated with them. There are 3 reasons why this is the case. Number 1, noticeability. When you interact with someone else and they're just tidying up or they're just doing something by themselves that's neutral in nature, you're less likely to notice that because it has no interference with the way you conduct your life. But when they do something that directly harms you, i.e. they are toxic to you as you believe, you are more likely to notice it to begin with. Number 2, the threshold to think about it and discuss. For something to be important for you to think about and discuss amongst yourselves, it has to have some level of importance to you, i.e. you have to believe it has had an impact on you. Number 3, for this to be something that blows up on social media, it has to have sensational value, i.e. the news needs to be more spicy. This person, this boyfriend of mine or this friend of mine is a toxic human being, has more spice than, by the way, someone cleans up a lot, he has OCD. Why is this piece of framing important? Number 1, it undercuts all of OO benefits because all of OO benefits are contingent on awareness of the positive diseases. If misdiagnosis happens, and it happens for negatively associated diseases, all the harms of OG are more likely to apply than the benefits of OO. This takes the debate over opening half for us because we've proven what kind of diagnosis is more likely and which diseases end up getting awareness. Already winning the debate against opening on that front. Secondly, why is misdiagnosis more likely to happen? Additional reasons from closing government. First, we completely agree that OG said that, you need professionals. The problem with this is the analysis for why professionals are needed is missing. This is because mental health is subjective. The same disease may have different symptoms of different individuals based on the contextual living they're in, which is to say you cannot jump to diagnosis at a point in time where you don't know the subjective realities of their past through hours of sessions by diagnosing them. Number 2, the nature of social media is such that it's really hard to filter accurate news. At a point in time where the vast majority of individuals just scroll through social media and in a capitalistic world have limited attention spans, there's very little involvement that they want to get into these kinds of diseases and understand them deeply unless they have an impact on themselves. So unless they themselves are the mental health patient or it's their child or their brother, most of these people will form opinions based on the first thing they see, which is that one social media status that a person who believes that they know this mental health issue deeply states. So this selection bias means most individuals start forming perceptions of what that mental health is poorly because of the nature of social media. Third, the way confirmation bias works is presumably all concedes there's stigma associated with these diseases already, which means you have preconceived negative associations with these diseases. What you're likely to do is confirm those notions by selectively picking news because of the way you're exposed to it and ignore anything that contradicts that by saying that this is irrelevant to the context. And the sheer fact that you know mental health is subjective makes you confirm your beliefs even more because you have more scope to ignore facts when presented in front of you. Lastly, when you are a party and you believe you're a victim, it is easier to feel closure when you can remove all blame for yourself and say that it was entirely the fault of the other person through mental health and you had no role in it. So for example, you might just have a shit boyfriend who, because you were shit to them at some point in the past, was bad to you. But it's easier for you to get closure if you say that this person has mental health issues. All of this proves that the misdiagnosis of this disease is more likely. So on the alternative, even if the diagnosis is slow, it at least happens at a better pace. The harms of misdiagnosis that OG talk about are reliant on these mechanisms. Therefore, because we're logically prior to OG, we take their impacts. Before proceeding, CO, yeah.
Your mechanisms that you outline at the top of your speech explain why the negative usage of these terms are already likely prior to the popularization to be used. Therefore, the trend has to pertain to the positive or neutral usages.
No, the negative usage of these terms would not happen from the perspective of mental health. The harms apply when the perspective is of mental health. I'll just give you some additional harms. The first, there's an anxiety that everyday individuals go through, individuals who don't have mental health because they can't diagnose themselves. When you highlight specific things like tidying up a room as mental health issues, you put a lot of people that are just tidy in nature into doubt, i.e., do I really have mental health issues? The problem is, OO doesn't prove that they've solved the access to mental health to begin with just by popularizing the language, because the taboo that exists with certain kinds of mental health still exists. But the fact that mental health is bloody expensive means a lot of these people can't go and seek out professional help instantaneously, or even if they go once, can't have a series of sessions that reaffirm their beliefs that they don't have this mental health. So a huge number of individuals start living in crippling anxiety who are far greater than the group that OO talk about, that now believe their lives are worse off because they may possibly have mental health. That's why a vast majority of these intellectual debaters are depressed, because they question whether they're happy to begin with, despite winning so many competitions all the time. The second is, we just believe a lot of people with mental health, but living on the lower end of the spectrum, would be better off without diagnosis. So someone with mild ADHD or mild OCD would just go off feeling like they're just another individual who's slow at learning. But the fact that you diagnose them means they feel that there's something wrong with them inherently by birth that they can't fix. These are the groups of people that you put in a worse situation. The conclusion is simple. Even if certain people are diagnosed better, which you haven't proven, the group of people that you harm on the sideline are significantly greater in number and ought to be weighed more than them. Very glad to propose.
Thank you very much for that speech. I'd like to call upon the third speaker for the opposition.
I personally am not depressed. So according to like a member of government, I'm either not a good debater or CG or false. I'll let the two whips decide that for themselves. But what does this debate need? This debate needs some framing and characterization. The reason for this is that a lot of the claims that are made in this debate can be true in a vacuum, but aren't like necessarily true given a consideration of the language used and the popularity itself. So that's what we're going to fill in here. Firstly, in terms of framing, this rise in popularity of usage of these terms like therapy speak is a consequence of the increased mental health support and conception and acceptance of mental illness within society. Because when more people have access to this language is available to them, they can use it and it can be understood. Prior to this, it has to be based off of the usage of it, prior to the popularization of it, has to be based off of the individuated instances in which these things are depicted in media and are broadly understood. So see, for example, schizophrenia or sociopathy being depicted as murderous or evil inherently. CG's own mechanisms as to why the negative usages are more popular or like it can gain more popularity is specifically the mechanism by which they were the ones which had the power before the popularization in and of itself. So on a consideration of framing, closing government is out. First claim then on the comparative. Prior to the rise of popularity, this language was illegitimate or taboo. CF calling someone OCD when this was bound up in social stigmatization of mental illness. Therefore, it was only used in the negative aggressive contexts because there's a prior connotation of these terms that was powerful. When it is popularized, it loses its taboo and it gains a sense of legitimacy. See, for example, the fact that we can say damn now, but we couldn't say it 100 years ago. This means that it can now be used positively or neutrally, which is to say excessive cleaning can be now said, oh, this is my OCD. And even though it's not necessarily accurate, it necessarily decreases the negative element of the way in which this term is used in like the logos, right? The public referent pool of what the term inherently means. This beats the rest of the debate. It beats top half because OG are hung on the increase being negative usage and OO are hung on the increase being positive usage. We're going to co-opt MG's own like weighing on this to beat top half as well, but also defeats CG's first extension because it explains why the things which they are afraid of were happening prior to the popularization of this mental illness regardless, and therefore their claims are unlikely to be persuasive along this lens because the delta of change is much larger on the positive or neutral senses. So, second extension, this is the most important one. How does language function? Well, it can't be meaning because meaning is shaped over time. Many things mean different things in different contexts. So shoot to a gunman versus a footballer means a different thing. My back hurts versus go back home means very different things. Even when they're used in the same context, they can oftentimes have different meanings. See, for example, the fact that cleave can mean to put two things together or to separate two things apart, to rend them. Therefore, it is not the context in which it's used on the inherent way, but the way in which the terms are used in and of themselves. We say it's reference and usage there. Like on a construction site, if I say a slab, you bring me a slab. And if we both think that ball actually means apple, and I ask you to hand me a ball, you'll give me an apple. What might ontologically be an apple, but in the language game we are using is a ball. Therefore, it is contextual, but also contextual based off of the social referent of the usage. See how the word literally has come to mean figuratively or definitely. So overall then, this framing is necessary because this is necessary for opening opposition's claim that because it's used in different contexts, it doesn't gain the same connotations, because when we're able to cleave, in the sense of separate, the terms in its medical usage from its social usage, that is the necessary context for opening opposition's claim on the terms being used in different contexts having different implications, conditions to actually matter in the context of this debate. Second thing then, and this is more important, is on the behavioral normalization that this therapy speak brings about. How is this language used? So some behavior is like quirky and irrational, right? Not usually delegitimized, but quirky in and of itself, like flicking the lights on and off, minor compulsions of cleanliness, etc. People seek justification for this kind of irrational action, either because they're asked to do it or feel a pressure to explain their behavior to other people, because the premise of our humanity and our mind is that we have rational actors like the Homo economicus or whatever, but also internally, right? You have to co-align it with your own identity and your understanding of yourself. And so if you do something that you can't know the justification for, you need to come up with a justification for it. Therefore, when this language now becomes available to people in terms of popularization, and this is how the popularization has functioned, they're more likely to use the language in this specific context, which is to say, they're likely to say things like when they flick the lights on and off, we're like, oh, well, that must be just some element of OCD in me or that kind of thing. Even if it's not accurate, that's how it's used within the world. Notably, this is specific behaviors being justified rather than like a sense of self or personhood, right? It's the thing you're doing that you're seeking to justify, like justify through rational lenses, not moral lenses, on the basis of this kind of language. It's used to describe normally abnormal activity because popularization means it gains a meaning outside of its medical context. You could see this because if you think of the intuition, if someone asks you if you did this, like if you said, oh, this is my OCD, wait, do you really have OCD? You would say no, but you know what I mean, right? It calls for an explanation of usage, which in and of itself creates the shift in language. Before I unpack this and explain what it means for the rest of the debate, I'll take closing government.
Do you think the popularization of the word toxic has been in a way in which has made toxic seem more positive than it previously was?
I actually think it categorically has. I don't know if closing government spend much time on Twitter, but someone will be like, oh, I guess I'm just a little bit toxic. That undermines its usage. But also, I think the previous examples that we talked about means that words like toxic, because they entered into the public lexicon prior to the popularization of these trends, were the kinds of things that are likely to be used on government alongside opposition. The delta of change necessarily is in the positive usages, as we've outlined there. So I don't think that claim is going to actually give closing government any weaponry in the context of this debate. What are the impacts of this and why does it win the rest of the debate? Firstly, it normalizes not the illnesses themselves, which are still stigmatized because of the different contexts in which the language is used, but notably it normalizes the behavior associated with these conditions in and of itself, because it creates this normalization of this thing being a justified action, because any given person may have this compulsion or any given person may have this tendency towards a particular thing, the kind of atypicality along a typical lens. Therefore, it has a ground up trajectory in terms of changing the public understanding of these illnesses, I think in two ways. Firstly, insofar as people with genuine attributes of these illnesses do engage in these kinds of activities, it no longer is seen as strange or directly attributed in a negative way and doesn't call upon that same kind of scrutiny. But secondly, insofar as individuals are oftentimes unsure in and of themselves whether they have these kinds of problems, when they do these kinds of actions, it allows them that kind of better sense of self. Flips CG's second extension. Second thing, people on the edge of the spectrum or who may just have some compulsions or hyperactivities but aren't medically diagnosable with these conditions, and that pertains to the vast majority of individuals, now have a rational justification for the reasons why they're doing particular things. This allows you to co-align your sense of self with your identity, to co-align your intentions with your actions, which gives people a stronger sense of self and a justification and confidence in themselves. And thirdly, crucially though, it means that the rest of the debate is broadly speaking non-comparative, because a lot of top halves claims, and indeed CG's as well, are hung on the idea that there is an inherent connotative link between the usage of these terms in their medical context and the use of these terms in their social context, and that the changing of how one is used impacts the changing of the other or how people understand the relation to them. And we're able to explain to you there is a distinction inherently between these kinds of usages of terms and the way in which that manifests towards people in terms of their understanding of themselves. That means that any impact we were to bring you in closing opposition, the strength of them is strong, is able to win the debate. Oppose.
Thank you very much for that speech. I'd like to call upon the final speaker for the government.
Hi, am I audible and visible?
Yep.
Okay, I just need to make something clear because it's being recorded. Just as a disclaimer, none of my opinions on the speech are reflective of any of my past, present, or future employers. Just as a form of precaution, this is just competitive debating. Yeah. Starting my speech in 3, 2, 1. This debate needs a lot of framing rectifications. And the reason I say this is, if you look at both the opening opposition and the closing opposition case, they are not clear on a very big thing within this debate, which is that, yes, therapy speak became more popular, and yes, therapy speak became more prevalent throughout the world and so on and so forth. However, as Sajid pointed out, we were already moving towards a world where we were more liberalizing, where we were making things more accessible, so as to speak. The movement that started with the psychiatrists in the 30s and 40s made it much more popular throughout. They are yet to give you any reason as to why the popularization of mental health issues or the awareness created of mental health issues is unique to the usage of these terms in this particular way, where by the definition of the info slide, it is done in a way such that it is inaccurate in the sense that it does not refer to its medically prescribed sort of definition and so on and so forth. They're yet to give you any analysis as to why this is inherent to this form. I'm pretty sure like OpWhip may try to do so. I'm pretty sure they'll fail to do so in this particular instance. But a few forms of like rebuttals before I go on to this, and I think this will address like both the op-bench cases. First, in terms of, they really rely on both the op benches on people using this in a particularly good way. And I'll give you reasons as to why people will not use this in a particular good way. A very obvious one at the top, they do not have the expertise to do so. In a lot of cases, things like ADHD, OCD actually require a lot of sophistication to speak about that these individuals don't have by dint of the fact that they're general individuals instead of mental health professionals. Number two, as Sajid pointed out, they have perverse incentives in a lot of cases. So for example, your interaction with someone may require you or may sort of push you in diagnosing them to a particular mental illness that you know has a lot of negative connotations attached to it, or calling someone toxic because you do not like that person in that particular sense, and then using it as a tool against them, because this happens all the time and people have these perverse incentives. In their world, this is something that is accessible to people. And the reason this is so very important is the fact that a lot of these terms carry stigma with it, and everyone agrees to this. The more accessible it becomes to people, the easier it is to not give any justification to why you are calling someone toxic and so on and so forth, and then using it against them. But secondly, I think it's important to understand as to why is it that in a lot of instances, making these terms positive or more prevalent. So for example, the example used by closing opposition is like, oh, I have a bit of an OCD because I do this and so on and so forth, is actually quite harmful towards individuals who actually have OCD if you give a positive spin to it. And the reason behind this is very simple. It is that oftentimes you're buried under discussions of just casual mentions of OCD here and there because of the simple fact that there is a confirmation bias on your side to portray OCD in a way such that you have viewed OCD in that sense. And in that particular sense, even if you give a positive spin to it, it is actually more important. It is actually better for someone with OCD to have a more serious discussion of it to realize the extent of their problem. And the reason this is very important is unless this person takes this problem seriously, they won't go to a therapist. They won't go to a professional, because as Sajid pointed out, therapy, mental health professional access, and so on and so forth, it's very difficult across the world, especially in developing countries, means that you actually have a higher threshold of whether or not you go to therapy. It's not as low as opening opposition points it out. And at that particular point in time, it's important to not dilute the seriousness of this, which happens across opening opposition and closing opposition by their own characterization. At that point in time, when you dilute it, you actually hurt people who actually need desperate attention, because to them, but this person has OCD, does a 9-to-5 job, is fine, is living their life fine. As I see on social media, so does 10 other individuals. I probably don't need much help, even though I probably have a very serious case of OCD, is actually something happens in their world that is particularly problematic. Before I move on to more opening opposition.
Even if liberalization happens anyways, when you have friends describing you with therapy speaks in good faith, you're more likely to want to seek legitimate confirmation of this from a figure of authority. Friends are likely to do this in good faith because they care about you, so they won't just use this frivolously or as a compliment.
Great. So assuming that friends generally have a positive incentive in this particular instance, what I do not understand in this particular case is, why do you need to make therapy speak in the way it is and in the way it is described in the info slide, something that is so popular, instead of actually having discussions and threads on it where people portray their experiences with, for example, therapists and so on and so forth? Why is this particular discussion contingent on therapy speak? You can have discussions on mental health without having therapy speak per se, because you know for a fact that your friend is suffering from mental health problems because of the fact that mental health is something that is recognized by people, maybe not recognized by people as much as Bench wants to point out, although that part of the analysis is very shady on their side. So I'm not sure if even they have proven that. But even in that particular instance, why is it that? So the comparative is very clear. Under their side, there are 100 threads describing OCD. 99 of them are horrible and diminish the importance of OCD throughout, dilutes the importance of it. One thread is probably good and refers it to people. Maybe some people have access to it, maybe some people don't. Under our side, maybe you have 5 threads, 4 out of which is actually about people with actual OCD speaking about their experiences on places like Twitter, Reddit, and so on and so forth, which people get access to and then can have that discussion, because their discussion is not diluted by popular speak of therapy speak, because that's what essentially happens in those particular instances. So with that being said, I think op bench is pretty much packeted at that point in time. I'll explain why we won't win over opening government in this particular instance. So opening government points out that, you know, incorrect usage happens and that leads to a problem in that sense. But what they don't do is they never mechanize as to why is there an active incentive in a lot of cases for people to incorrectly use this throughout. So if you look at your notes, you'll see that Sajid is the only speaker that gives you structural analysis as to why it is likely that that individuals will lead to the wrong conclusions in vast majority of the cases because of the way in which structural discussions happen, not only in social media, but in the way in which humans interpret these things. And this has already happened to a large extent in social media, and we have seen this, but we are the only team that mechanizes this particular thing. Secondly, OG talks about, like, in a lot of cases, like when toxicity and like gaslighting, etc., are you know mentioned in a satirical way in social media, they actually don't give you structural analysis as to why in social media, in a world of social media where individuals are more prone to clicking on things like clickbait and sensationalization, as to why limited attention spans means that these are individuals who are not likely to go through the whole trouble of switching to another tab and actually looking up for credible information. But in a lot of cases, even a single stroke of Google is not important, because oftentimes credible information is very hard to read, because oftentimes it uses technical language and so on and so forth. All of this analysis is coming from closing government, meaning that a lot of the impacts portrayed in opening government are fully contingent on closing government. At the end, the op bench is yet to tell you the uniqueness of this in terms of increasing awareness. We have given you enough harms in closing government to prove that we win this debate. I'm fairly proud to propose.
Thank you very much for that speech. I'd like to call upon the final speaker for the opposition.
Perfecto. Thank you. One sec. Panel, we received one response to our case. I don't know if they're trying to take a second. That was a mistake. What was it? It was that the awareness of all these things happen anyway. This is a fundamental misunderstanding of what Dylan brought to you, because this does deal with OO, as pointed out in the very Prime Minister's speech, the idea that people have a general awareness of these conditions and the way they work within the medical sense. But crucially, our very case is that the way this is used when it is popularized is that it generates a secondary meaning. There is the medical sense of the word ADHD, and there's the popularized, there's the on the ground sense, the kind of cultural sense of the word. That is what is generated via this. OO, say contexts, they do not mechanize how you are able to transfer words into different contexts and how that mechanizes the way that people's understanding changes over time. They just assert if you use it in a certain way, people will understand. No, they won't, because if they only have one conception of the word, there's one conception they refer to. The whole point is you have to generate a secondary conception. That's what differentiates us, and that's what means the literally only response we get just doesn't work, which means, as Dylan pointed out, the way our case interacts with closing government, we're already beating them. What does this mean? It means A, you get a greater understanding of yourself and others. It's things like, yeah, sure, you may not even necessarily know the medical term for gaslighting anymore, because maybe you don't get full awareness of that, but I don't care, because medical gaslighting is too late to spot. It is on the ground, slightly misused understanding of gaslighting. That is what you can spot early enough to get out of a potentially abusive relationship. But B, this is why you do not dilute the original term, because people have this understanding that it is not the same term being used. It's a secondary meaning, it is a different use of the same reference, and therefore it does all the points that we just heard in the government whip about diluting the meaning, which is also in the Prime Minister again, and the Deputy Prime Minister, does not occur because people have a basic understanding of how words work. I want to just deal with some things that are extraneous within OG to the way that this language is specifically used, some fact claims they make. They say people will not be taken seriously. There'll be a lack of care, and then you get things like self-medicalization and stuff. The PO I point out is that if it is true that there's an impotence for awareness, why doesn't that awareness in the medical sense, why isn't that meaning of the word communicated anyway? The response we hear is that, but this comes at the cost of that. But no, OO assert that these people will be corrected. But the very point is that the Prime Minister's framing mechanizes that point within opening opposition. The impotence to generate correct understandings, the liberalization that closing government talk about, all these are reasons why you get a correction, why you get a preservation of the medical thing. And you act out and you prevent things like self-diagnosis and self-medication, and you make sure people do actually deeply care about these issues. They also talk about legitimizing discrimination in the Deputy Prime Minister, but note, we point out that the power is always there anyway with slurs, which is obviously the likely counterfactual in times where you're trying to discriminate against people. They say, but this is not used negatively. That is obviously untrue, because if the whole point is to use it negatively, you are using it negatively in a discriminatory way. But the other way is that, this is pathologizing, so it's a little different. But note, crucially, the words lose power over time because they become destigmatized. If everyday normal behaviors, which are not full gaslighting, or which are not full, say, ADHD, become referred to as such, the power of them as a slur or as a stigmatory word is lost, and therefore it is better that it actually happens in the long run. Sure, some diagnoses happen of like rich celebs, full-blown diagnoses, all that pathologization. They are rich, I don't give a fuck, they're probably fine, there's not that many of them, there's more actors in the debate. What then is the important thing in this debate? It's the way that the language is used. I want to deal with CG first on this. Before I get into the way that Dylan's analysis disproves them, I want to point out two issues with their framing, and it's the first two mechanisms. They claim one, noticeability, so therefore you're going to always point out the bad things. Note what's crucial here is that popularization means that all of these things become noticeable. The idea that everyday behaviors are now seen as things which is, say, OCD or ADHD makes them noticeable in and of themselves, and therefore all of these behaviors are noticeable because of the popularization in and of itself. So that mechanism does not work. But secondly, the likelihood to discuss, the threshold of I think this is important, panel, just this is realistic. The thing in front of you is the thing you think about at any one moment. So that is what you're going to talk about in that moment. If you see someone flicking on an off light switch, you will say they're OCD. If you see someone being abusive slightly, you will say they're a gaslighter. It's obviously that's what happens in the moment. What's their third mechanism then? It is the sensational value. And this is where Dylan's analysis starts to come in against closing government. Because we point out that, sure, news and drama and all these kind of things may happen a bit. But one, drama is likely small scale because of the use. That is to say, people get a different understanding of very normal behaviors being seen as these things. So it's not actually that drama. It's not, the sensationality loses power over time. But two, celebrities, I don't care again. And three, this is again prior to the popularization. Their very framing is the reasons why the original things you do, the original things before this trend became widespread, is the things which are the most sensational. They're the things you defer to first, and therefore the things which are popularized are probably the secondary behaviors, things like OCD and ADHD discussions. They talk about misdiagnosis separately in closing government. And what is the issue here? They say one, selection bias, but note crucially, this is not used in this way of necessarily like harmful, huge behaviors, because you're using things which are similar to the medical condition, but it's not the medical condition itself. So you don't get a confirmation because it's not confirming the same meaning. It's an entirely different meaning, and therefore that mechanism ceases to work. But secondary, they talk about closure, but note here, one, over time, this mech gets less persuasive because the power of the specific behaviors is lost. But secondly, this is obviously prior to popularization. You will always call your ex crazy or wrong or mean or abusive because people want to feel right, and they want to feel as if love wasn't lost to them, rather it was the people being wrong in and of themselves. Crucially then, we do get a better understanding, and also the way that this is used over time, because note this is a status quo debate, not a counterfactual one, means that over time this meaning is likely to get more and more persuasive and more separate from the medical term, as therefore is not used in all the negative ways closing government says, so their case is defunct. Opening government, what you have.
Yeah, a secondary conception may exist, but we give a set of reasons why the average person is unlikely to be able to differentiate it, given the way it's used in the first place and why the consequences of that.
You don't give reasons. I can cut you off. I have the right. So crucially then, you don't give reasons. You say the idea that people conflate them, but the very idea which Dylan mechanizes their case is that no, you necessarily don't, because if people conflate, they ask you, wait, what do you mean that was ADHD? Isn't that like, this is a very different thing to what I just did? And it's like, oh yeah, but you know what I mean. It's not this full, huge medical definition. People explain what they mean by words. That's how they change within context over time, which crucially takes us over opening opposition, because one, without this, the just general basic awareness and the stuff like introspection, because notably introspection for people who aren't just on the edge of spectrums, it is painfully obvious for them. You don't need to hugely introspect. So therefore their overall case is marginal at best. But secondly, they're missing analysis for how this is used every day because they don't mechanize how it can just be used in different contexts. And three, they're contingent on the use being done in a good way, or else they get all the bad misdiagnosis and stuff that Gov pushes them on. But this beats OG because one, people don't feel bad because they may understand that as a joke. They understand that this isn't the original medical thing, and therefore they don't lose ownership of their own narrative. But also, you don't get the stigma of speaking up because crucially, people can point out their own behaviors because they are seen as normalized behaviors, and then they can go, hey, maybe I can get a diagnosis because this is a normal thing, but it's also something that maybe potentially goes further than that. And crucially, abusers. Look, I just don't think this is the tipping point. And as I pointed out in my introduction, after I rebuilt, that crucially, we get the awareness early on these small scale interactions. This is the thing which is sufficient, not the medical awareness of gaslighting, which is always too late. Thank you.